Introduction. Welcome, students, to today's lecture on the topic of selective serotonin reuptake inhibitors, SSRIs. SSRIs are a widely used class of medications in the treatment of various psychiatric disorders, including depression, anxiety, and obsessive-compulsive disorder. Understanding the mechanism of action, pharmacodynamics, pharmacokinetics, drug interactions, efficacy, metabolism, adverse effects, and other important aspects of SSRIs is essential for prescribing these medications safely and effectively. In this lecture, we will delve into the intricate details of each topic to provide you with a comprehensive understanding of SSRIs. So without further ado, let's jump right into it. Selective serotonin reuptake inhibitors, SSRIs, work by blocking the reuptake of serotonin in the synaptic cleft, thereby increasing its concentration and enhancing its neurotransmission. To elaborate on the mechanism, SSRIs selectively bind to the serotonin transporter protein, inhibiting its reuptake function. This leads to increased extracellular levels of serotonin, resulting in prolonged serotonergic transmission. By modulating serotonin levels in the brain, SSRIs exert their therapeutic effects in psychiatric disorders. It's worth noting that the specific mechanisms underlying the efficacy of SSRIs are still not fully understood and are a topic of ongoing research. The pharmacodynamics of SSRIs involve their interaction with various serotonin receptors, predominantly the 5-HT1A, 5-HT1B, 5-HT2A, and 5-HT3 receptors. By acting on these receptors, SSRIs modulate neuronal signaling pathways and influence mood, emotions, cognition, and behavior. Additionally, SSRIs also interact with other neurotransmitter systems, such as the norepinephrine and dopamine systems, albeit to a lesser extent. The complex interplay between these systems contributes to the overall pharmacodynamic effects of SSRIs. The pharmacokinetics of SSRIs involve their absorption, distribution, metabolism, and elimination. Factors like food intake and formulation can affect their absorption. SSRIs bind strongly to plasma proteins and are primarily metabolized in the liver by the cytochrome P450 enzyme system. These metabolites are eliminated through urine and feces, with individual differences in enzyme activity influencing drug response. When prescribing SSRIs, it is important to consider potential drug interactions. SSRIs can interact with other medications that affect serotonin signaling pathways, leading to serotonin syndrome. They can also alter the metabolism or elimination of co-administered drugs, affecting their efficacy and safety profiles. The selectivity of SSRIs allows them to primarily target the serotonin transporter protein, reducing side effects. However, some SSRIs may have additional effects due to binding to other receptors. Binding affinity varies among SSRIs, affecting potency, duration of action, efficacy, side effects, and individual responses. SSRIs have demonstrated efficacy in the treatment of several psychiatric disorders, including major depressive disorder, generalized anxiety disorder, panic disorder, social anxiety disorder, post-traumatic stress disorder, PTSD, and obsessive-compulsive disorder, OCD, among others. The underlying mechanism of action of SSRIs, namely the modulation of serotonergic neurotransmission, contributes to their therapeutic effects in these conditions. However, the response to SSRIs can vary among individuals, and careful consideration of patient-specific factors is necessary when selecting the appropriate SSRI and dosage. The metabolism of SSRIs can exhibit significant inter-individual variability, leading to differences in drug response and potential variations in therapeutic outcomes. This variability is primarily attributed to genetic polymorphisms in the genes encoding cytochrome P450 enzymes involved in SSRI metabolism. Polymorphisms in the CYP2D6 and CYP2C19 genes, in particular, have been extensively studied in relation to SSRI metabolism. Poor metabolizers, extensive metabolizers, and ultra-rapid metabolizers are examples of phenotypes that can influence the pharmacokinetics of SSRIs and impact treatment response. While SSRIs are generally effective in the treatment of psychiatric disorders, some patients may experience a diminished response over time, leading to treatment resistance or decreased efficacy. The development of tolerance can occur due to various mechanisms, including desensitization of serotonin receptors, compensatory changes in neurotransmitter systems, or altered pharmacokinetics. It is important to monitor patients closely for treatment response and consider alternative treatment strategies in cases of treatment-resistant depression or inadequate response to SSRIs. Although SSRIs are generally well tolerated, they can be associated with a range of adverse effects. Common side effects include gastrointestinal disturbances, sexual dysfunction, sleep disturbances, weight changes, and mood alterations. Serious adverse effects such as serotonin syndrome or hyponatremia may occur but are relatively rare. It is essential for healthcare professionals to educate patients about potential side effects and implement strategies to manage them effectively. Adjusting the dose, switching to a different SSRI, or utilizing adjunctive medications are some approaches to address troublesome adverse effects. Discontinuation syndrome, also known as SSRI withdrawal syndrome, can manifest when SSRIs are abruptly discontinued or rapidly tapered. Symptoms can include dizziness, nausea, headache, irritability, insomnia, sensory disturbances, and flu-like symptoms. Discontinuation syndrome is thought to result from the sudden withdrawal of serotonin reuptake inhibition and subsequent adaptive changes in neurotransmitter systems. Gradual tapering of SSRIs and patient education regarding potential withdrawal symptoms can help ameliorate the impact of discontinuation syndrome. The use of SSRIs in special populations, such as children, adolescents, pregnant women, and the elderly, requires careful consideration of potential risks and benefits. SSRIs have demonstrated efficacy in pediatric and adolescent psychiatric disorders, but close monitoring is necessary due to the increased risk of adverse effects, including suicidality. In pregnant women, SSRIs pose a potential risk of fetal complications, particularly when exposure occurs during specific gestational periods. Furthermore, differences in pharmacokinetics and pharmacodynamics in the elderly population can influence the selection and dosage of SSRIs, necessitating individualized treatment approaches. The field of SSRIs continues to evolve, with ongoing research focused on elucidating the underlying mechanisms of action, identifying predictors of treatment response, and developing novel therapeutic strategies. Emerging research includes investigating the role of genetic markers in SSRI response, exploring the potential use of combination therapies, and exploring the effects of SSRIs on neuroplasticity and neurogenesis. These advancements hold promise for the development of more tailored and effective treatment approaches. In conclusion, SSRIs are commonly prescribed drugs that effectively treat psychiatric disorders. Healthcare professionals must grasp the intricate details of their mechanism, effectiveness, safety, and interactions to ensure optimal patient outcomes and improve the well-being of those with psychiatric conditions.